Welcome to the deep dive. Today we're tackling something I think a lot of us pet owners can really relate to, car ride anxiety in our dogs and cats.
Yeah, it's definitely a common challenge. Seeing them stressed during travel, whether it's just down the road or, a longer trip, it's tough.
It really is. So let's talk about what this actually is, this car ride anxiety.
Well, essentially, it's when a pet shows excessive distress, maybe fear, or even outright panic when they're in a vehicle.
Okay,
And sometimes, what looks like excitement like panting or pacing might actually be anxiety. It's easy to mistake.
that's a key point. Panting could be happiness, or it could be overwhelm. So our mission today is to really unpack this, look at the causes, the signs, and most importantly, what we can actually do about it.
Exactly. We're drawing on expert info to give you a thorough understanding, but hopefully without making it too overwhelming.
Perfect. Let's start with the why. What causes this anxiety? I imagine it's not always straightforward.
You're right. The exact cause isn't always known for every single pet, but there are definitely common factors.
Like what?
Well, a big one is just not having enough positive experiences with cars early on. If
Ooh.
those first few rides weren't great, or maybe didn't happen during that key socialization period, that can really set the stage.
Right, like first impressions matter, even for pets in cars. Makes sense.
Totally. And then there's general anxiety. If
Uh-huh.
a pet is just generally anxious, they're probably more likely to be anxious in the car too.
Okay, so it might be part of a bigger picture for some animals.
It could be. Also, negative learned associations are huge.
Oh.
Think about it. If the car almost always means a trip to the vet,
Oh, yeah. Mine definitely knows that carrier means vet visit.
see, they learn that association. Or maybe there was a traumatic event like a car accident, or even just really scary weather during a drive, or, rough driving, sudden stops.
So bad experiences stick with them.
They really can. And we can't forget motion sickness. If they feel physically ill in the car, they're obviously going to start dreading it. That nausea can trigger anxiety.
You mentioned genetics earlier in our prep. How much does that play a role? Is it inherited?
Well, there might be some genetic predisposition towards anxiety in general, but honestly, for car ride anxiety specifically, the evidence points more strongly towards those early experiences being the bigger driver.
So nurture over nature, perhaps, in this case?
It seems that way often, yeah. But we also absolutely have to consider underlying medical issues. Sometimes a health problem can actually cause or worsen car anxiety.
Really? Like what sort of medical conditions?
Obvious one is motion sickness, like we said,
Yeah.
but also pain, maybe musculoskeletal pain, arthritis. Think about getting jostled in a car if your joints hurt,
Oof, yeah, that would be miserable.
right? Or even dental pain, stomach upset. Anything that makes them physically uncomfortable can ramp up the anxiety in that environment. And some pets are just hypersensitive to sounds, sights, smells. The car can be sensory overload.
So it's a complex mix of physical feelings, learned fears, and maybe just their innate temperament. What about the behavioral side beyond just lack of experience?
Yeah, behaviorally, limited exposure to the world outside the home in general can be a factor. Not just cars, but everything. Then there's poor adaptation to, say, carriers or restraints, if they haven't been properly introduced and feel trapped.
That's instant stress?
Exactly. And fear of stuff outside the car, other people, dogs, loud trucks, that fear can feel much more intense when they're confined inside. And again, if they have generalized anxiety anyway, car rides are likely going to be on the list of stressors.
Okay, that gives us a really good picture of the potential whys. Now, let's talk about spotting it. How do we recognize the signs? Because you said earlier it can be subtle.
Absolutely. And the signs definitely vary between individuals. For dogs, behaviorally, you might see things like pacing, restlessness. They might refuse treats.
Even if they normally love treats.
Yep, loss of appetite is a sign of stress. Also, being hypervigilant, looking everywhere, maybe seeming overly excited, whining, or that high-pitched, anxious bark.
Okay, I've definitely heard that bark. And what about cats? What are their telltale signs?
Cats often get vocal in a stressed way, growling, hissing, lots of meowing or yowling. Unfortunately, vomiting or even having accidents in the carrier are common too.
Oh, dear. Poor things.
And here's a really critical one I want to emphasize. Immobility.
Mm-hmm.
Sometimes a cat or even a small dog might just freeze, become completely still.
And you might think they're calm.
Exactly. But it's often the opposite. It can be a sign of extreme fear, like they've just shut down. Don't mistake stillness for calmness.
That's such an important distinction. Are there other things owners might miss?
Yeah, sometimes owners might underreport symptoms, especially that freezing behavior in cats and carriers. Or maybe they don't realize how severe the anxiety is in a small dog because it's less disruptive than, say, a big dog frantically pacing.
All right.
Behaviors that actually interfere with the driver, like a dog trying to climb into the front, those tend to get noticed and reported more often, understandably.
Because it's a safety issue, yeah. What about physical signs? Things we can actually see happening in their bodies?
Physically, you might observe panting, really rapid heart rate, though that's hard for owners to measure. Excessive drooling is a big one. And as we mentioned, sometimes urination, vomiting, or defecation can happen due to stress.
And if you took them to the vet right then, would the exam show anything?
Interestingly, probably not.
Yeah.
Unless there's an underlying medical cause contributing to the anxiety, the physical exam itself is often normal, even when they're showing all those anxious signs.
Okay. So we know some causes, we know the signs. Now, the big question, what can we actually do to help them? What are the practical pathways to peace in the car?
Right, the solutions. It really requires a complete behavior program. We need to look at managing the environment inside the car, actively reducing their anxiety, and using behavior modification techniques.
Sounds comprehensive. Where do we start?
The foundation is compassion and preparation. Right. Seriously, just trying to understand it from their perspective. Avoid scolding them for being scared. They can't help it. Allow plenty of time for trips so you're not stressed and rushing.
Our stress definitely affects them, doesn't it?
Oh, absolutely. And try to anticipate triggers. If getting the carrier out is stressful, manage that part. If being near other barking dogs at the vet waiting room entrance is bad, avoid that. Plan ahead.
Smart. So think like your pet. What about managing the car environment itself? Safety and comfort.
Super important. They need stable footing. A non-slip mat can help. Secure resting spots are key. If they're already trained and comfortable, a well-secured crate can be their safe den.
Okay.
Otherwise, there are dog seat belts, barriers to keep them in the back, or even supportive slings for smaller dogs. These help them feel more secure and physically stable.
And what about dogs who get really agitated, trying to jump around?
For those guys, sometimes a head halter, like a gentle leader or a front-attaching harness, can provide better control than just a collar. But please, never use prong collars, choke chains, or shock collars during travel. That just adds fear and pain.
Absolutely not. Okay, so secure and safe. What about specific techniques to reduce the anxiety itself?
One strategy is restricting visual stimuli. For some pets, all that movement outside is just too much. Window shades can help. Covering the crate using a solid-sided carrier for cats.
Block out the scary stuff.
Pretty much. There are even products like Thunder Caps, which are like soft blindfolds, or Doggles, those doggy sunglasses, which might help some visually sensitive pets.
Doggles. Okay. What else?
Sound can be powerful. Psychoacoustically designed music like the Through a Dog's Ear or Cat's Ear series uses specific frequencies and tempos shown to be calming.
Interesting.
Even just classical music can help soothe some pets. And importantly, mask sudden scary noises from outside, like horns or sirens.
So create a calmer soundscape inside the car. Makes sense. What about those pressure wraps like thunder shirts?
Yeah, those can be quite effective for some animals. The gentle constant pressure seems to have a calming effect, kind of like swaddling an infant. It's worth a try for sure.
And pheromones. I've heard about Adaptil and Filiway.
Yes, synthetic pheromone analogs. Adaptil for dogs mimics the pheromone mother dogs release, and Filiway for cats mimics facial pheromones associated with comfort and security. You can get sprays for bedding or diffusers for the car.
So trying to signal safety chemically.
Exactly. And for pets with more severe anxiety, this is where we might really need to consider anxiety-reducing supplements or prescription medications from the vet.
Okay, we'll definitely dig into meds later. But first, what about changing their actual feelings about the car? The behavior modification part.
Right. This is about changing the association from negative to positive.
Yeah.
It takes time and patience. Start small, outside of actual travel.
How small?
Like practice just getting them to settle and relax near the car,
Right.
then in the car while it's parked and turned off. Use high-value rewards, amazing treats, favorite toys, just for getting in calmly, for settling down.
So making the car itself a rewarding place to be.
Precisely. Keep sessions short, positive, and end before they get stressed. Don't even start the engine initially. Just associate the car space with good things.
And for carriers.
Same idea. Get them used to the carrier itself first. Then, for cats or small dogs, practice gently picking up the carrier, moving it a tiny bit, putting it down. Reward calm behavior throughout. Gradually increase the motion.
Building tolerance step by step.
Yes, and during actual trips, provide comforting activities if possible. A long-lasting chew toy, a food puzzle, something positive to focus on. And again, never reprimand or intimidate them if they show anxiety. That just makes it worse.
Got it. Positive reinforcement all the way. Now let's talk about medications. When do they become part of the plan?
Medications can be incredibly helpful, especially for pets with moderate to severe anxiety or for necessary but infrequent travel. They can make behavior modification easier and more effective, too.
So they work alongside the training.
Ideally, yes. Short-acting anxiolytics, anxiety reducers are often used for occasional travel. The key is giving the dose before the anxiety starts, usually 30-60 minutes prior, sometimes longer depending on the med.
Timing is critical.
Very. Because once they're already panicked, the medication won't work as well.
Mm.
But it's also crucial to have realistic expectations. Meds might not eliminate anxiety completely, especially in severe cases. And very important, never use punishment-based training if a pet is on anxiolytics.
Why not?
It can lead to unpredictable reactions, potentially aggression, because their perception and learning are altered. It's contraindicated.
Okay, good to know. What specific types of medications are typically used?
Well, if there's concurrent anxiety, like separation anxiety plus travel anxiety, a vet might prescribe a longer-acting daily medication like an SSRI or a TCA. But for travel-specific anxiety, benzodiazepines are common.
Like Valium or Xanax for people?
Similar class, yes.
Well-
Names like alprazolam, diazepam, clonazepam, lorazepam. They work by enhancing GABA, a calming neurotransmitter in the brain.
Okay.
They need that 30-60-minute lead time. Potential side effects can include sedation, increased appetite, muscle relaxation, sometimes temporary amnesia.
Amnesia. They might forget the stressful ride.
Potentially, or at least aspects of it, which can be good, but as I mentioned, it might also interfere with learning new positive associations during training. There are nuances. Some, like lorazepam or oxazepam, might be metabolized differently, making them potentially safer choices for pets with liver issues. And there's even an injectable, midazolam, that acts very fast, sometimes useful after a stressful event like a vet visit to calm them for the ride home.
That's a lot of options just within that one class. What about motion sickness meds? You mentioned meropetent earlier.
Yes, meropopatin, brand name Cerenia, very effective for motion sickness in dogs. Interestingly, the dose for preventing motion sickness is higher than the anti-vomiting dose.
Higher, okay.
Yeah, it's usually given about 2 hours before travel. Fasting the dog for an hour or so before the dose and avoiding high-fat foods around that time can help with absorption. For cats, it's often given as an injection by the vet to control vomiting during travel.
Got it. And what about trazodone? I feel like I hear that one mentioned a lot for dog anxiety now.
Trazodone is used quite often. It's a serotonin antagonist and reuptake inhibitor, or SERI. It helps with anxiety. For dogs, the dose can vary quite a bit, and vets usually start low and go up if needed. It seems to absorb faster on an empty stomach.
And for cats?
It's used off-label in cats sometimes, yes, but perhaps less commonly for travel anxiety compared to dogs. Definitely something to discuss with your vet.
Okay. What about acepromazine? That's an older drug, right?
It is. Acepromazine, or ACE, is primarily a sedative. It makes them drowsy, but it doesn't actually reduce the feeling of anxiety. They might look calm, but they could still be terrified internally.
So it's not really addressing the root fear.
Exactly. Which is why it's generally considered a poor choice as the only medication for travel anxiety. If it's used, it's often recommended to combine it with a true anxiolytic, like a benzodiazepine or even pheromones, to address the fear component. But on its own, not ideal.
Good distinction. You also touched on supplements and sprays earlier.
Right, the Feline and Adaptil sprays are easy additions. Just spray on bedding or in the carrier 15-20 minutes before the pet goes in. And then there are several nutritional supplements like Angstane, L-theanine, Composure, which has L-theanine and other calming ingredients, Harmonies, Zilkine, casein. These might help take the edge off from milder anxiety.
Any evidence for things like lavender?
Some small studies suggest lavender scent might have a calming effect on dogs in stressful situations, like travel. But you have to be cautious with essential oils, especially around cats. They metabolize them differently, and some can be toxic. Best to avoid diffusing oils in the car with cats.
Okay, stick to the pet-specific products, maybe. Any big warnings about combining these things? Drug interactions?
Yes,
Yeah.
definitely. The main one to watch out for is combining multiple drugs that increase serotonin like trazodone with an SSRI or TCA. That carries a risk of serotonin syndrome, which can be serious. It's vital your vet knows everything your pet is taking, including supplements.
Full disclosure is key. Are there any other alternative medications vets might consider?
Sometimes clonidine is used. It's an alpha-2 agonist, typically a blood pressure medication, but it can have sedative and anti-anxiety effects in dogs. It might be used alone or sometimes added to an SSRI or TCA for complex anxiety cases. Dosing needs careful management by the vet. Its use in cats for this purpose isn't really established.
Wow. Okay. That's a really thorough look at the treatment options. Shifting gears slightly, how does a vet actually diagnose car ride anxiety? Is there a test?
No specific test, really. The diagnosis is primarily based on the owner's description, the history of what happens during travel, and the specific signs observed.
So the owner's report is crucial.
Absolutely. And the vet's job includes ruling out other things that could look like travel anxiety. We call these differential diagnoses.
What else could be mistaken for it?
Well, other fear or anxiety issues that just happen to manifest in the car.
Yeah.
But also ruling out underlying pain, nausea from something other than motion sickness, or general physical discomfort like being too hot or cold.
Makes sense.
And if the anxiety starts really suddenly, or there's a dramatic change in how the cat usually behaves in the car, that's a red flag. A thorough physical exam is definitely warranted then to check for a new medical problem.
So sudden onset needs a vet check.
Definitely. Basic blood work, urine tests, or imaging like x-rays aren't usually needed unless the history or exam points towards a specific medical concern.
Okay. And looking ahead, what about follow-up and the general prognosis for these pets?
It's really helpful if vets proactively ask about travel stress during routine wellness visits. Catching it early and intervening early is always better.
Because it can escalate if ignored.
It often does. And sadly, severe travel anxiety can become a major barrier to pets getting necessary veterinary care, which is a real welfare concern.
Yeah, if you can't get them to the vet.
Exactly. In some really extreme cases where the distress is profound and difficult to manage, the kindest option might actually be to avoid non-essential car travel altogether.
That's tough. Does it ever just get better on its own?
It's possible, maybe with repeated positive experiences, but honestly, it's much more likely to stay the same or worsen without active treatment and management.
So intervention is usually needed. Okay, let's try to wrap this up. If you had to summarize the key takeaways for everyone listening, what would they be?
I think the main things are recognize that car ride anxiety is real, it's common, and importantly, it's treatable. Understand that there are many potential causes, and the signs can vary a lot, sometimes being quite subtle.
Like that freezing behavior.
Exactly. Early recognition is great. And the most effective approach is usually multifaceted managing the car environment, using anxiety reduction tools, behavior modification, and sometimes medication is a necessary and helpful component.
And underpinning all of that is empathy, right? Trying to see it from their perspective and using positive methods.
Absolutely. Patience, understanding, positive reinforcement. That's how we help them build confidence and feel safer during travel.
This has been incredibly insightful. It really makes you pause and think. You know, we talked about how negative experiences are such a strong factor. It makes me wonder what seemingly small things during a car ride, things we might barely notice, could actually be contributing to our pet's anxiety.
Good point.
Like maybe a sudden lane change we make without thinking, or a particular sound like windshield wipers starting, or even just us feeling rushed and stressed behind the wheel. Could those little moments be adding up for them in ways we don't realize?
It's entirely possible. They perceive the world differently, and those small stresses could accumulate or become triggers. Observing them closely, not just for the big signs, but the subtle shifts during and after rides, could give us valuable clues.
Definitely food for thought. Well, thank you so much for this fantastic deep dive into car ride anxiety. For everyone listening, we really hope this helps. Remember to explore resources and always consult with your veterinarian for tailored advice for your specific furry companion.
Happy to help. Safe travels to everyone and their pets.
Until next time on The Deep Dive, take care.